Well, I'm Carol Engelhart, and I'm a board member for Physicians for a National Health Board in Minnesota, and also retired RN. I have Khadijah Ali here, who's a known leader in the immigrant community and a businesswoman. And Khadijah, would you describe a little bit of yourself right now?
Hi, Carol. Well, thank you so much for reaching out to us and seeking to know more information about the immigrant experience in Minnesota. My name is Khadijah Ali. I'm the CEO of Global Language Connections. We are a language service company based on Minnesota that provide about over 200 languages. So I'm honored to be here with you to share some of the stories we have collected from the immigrant community in Minnesota.
Well, Jose is very descriptive. As a Latino immigrant, I can truly say that he describes so perfectly how in this storm, this continuing storm that is exhausting to all of us, that his boat is so different than my boat. Would you describe to us a little bit about Jose and what you heard from him as your agency talked to him?
Yes, as you mentioned, Jose's life, has changed dramatically, just in a very dramatic way, just like everyone else. Obviously, he's been affected by the impact of the pandemic, and he lives in fear of what's going to happen. He can't provide for his family. He was let go of his job. He doesn't have an income. He doesn't have papers. He is obviously undocumented and cannot get the state aid of the stimulus checks people have received. And he said his church obviously is the only way he's surviving for the past few months. He is a very faithful man. He is a believer in God. He has a church that he goes to, but it's a very overwhelming experience. He doesn't know when he will be able to look for a new job or when he will be able to get maybe his old job back. And it's been very uncertain times. It's been very difficult for him. What he fears the most is him getting sick with COVID. And the fact that he doesn't have access to health care. He's been extremely overwhelming, and it's been a very difficult time. But he remains cautious and keep following, the Department of Health guidelines. He's consistently paying attention to the news and listening to the governor's office and directives. He said it's not easy, but I'm pulling through it. And his church has been the bedrock that's keeping him really alive and giving him sense of hope.
As I read through his story, I was just thinking, oh my gosh, he has just said this so well. And I like the way he said, it sucks, because it's true. We need to do better than this. We really do. We need to do better than this. And right now, I don't know if you know this, but the state of Minnesota actually has single payer for everyone, including undocumented residents, for one disease. So in this situation, Jose could go in if he tested positive for COVID-19 and get care from admission to discharge or anything for his clinic. The problem with that being is if you have anything else happen, like a blood pressure, a stroke, or diabetes, or you just don't feel well, you got a reaction to a bee sting or something, that's not covered. But right now in Congress, we have a Healthcare Emergency Act that would actually cover everyone, undocumented residents included, from birth to death, for all healthcare needs, not just COVID-19, as an emergency bill, because so many people are unemployed and because they didn't want the undocumented residents to not be included. If we could get this passed, I'd feel like that would be one more thing for Jose that he wouldn't have to stress about and say his life was not good. What do you think, Khadijah? Would that be a good thing for Jose, that he would have that at least?
Oh, absolutely. I mean, all of these people who are undocumented, we're getting calls of people who they think someone's calling them, who have a symptom from their community members, who have the symptoms of COVID, who might also have underlying issues. They're afraid of putting themselves in a more even vulnerable place because of their status, having access to healthcare, one of the things Suhaila said was she had toothache and she couldn't go. Imagine having a toothache and not being able to go to, to get a treatment, right? Or to see a doctor. So I think there's a lot that can be done to be more supportive and more compassion and kind to everyone who lives in our state. But I do believe, like Jose right now, he lives in fear. He lives in fear of not only of the unknown of, he said, not knowing when he'll be able to get a job. Before he said with recession, everything had a time frame. You knew, in a month or so, you might get back to work. There's still a lot of unknown because a lot of businesses are not going back to the way they used to the full capacity. For him, it's like the basic necessity right now. He just wants to survive, right?
He's not in the same boat. I'm in a different boat than him. Any of us that are legal residents are, and he's one of us. He's not the other. We need to look at this as we're here and to be supportive of one another, to listen to one another's stories. So that is why today we wanted to hear Jose's story so that we could know what it is like to be in Jose's life. Thank you, Khadijah, for sharing this today with us.